Welcome back. Today, now we're going to talk about the consented treatment. And again, it's one of the very basic and the most important patient rights. And you as a doctor should not conduct any kind of investigation or treatment modality without proper consent. Now we're going to talk about the consent. So in outline for this presentation, we will define what is an informed consented treatment, what is the ethical, legal, and fiqhi basis for such a consent, what makes a consent an ethically valid document, document one, what are the types of consent, when is it needed, when could it be waived, because sometimes we may make interventions without consent, and we will know when we can do that. How to take it, it's very, very important actually, how to take an informed consent. What if the patient is not able to give a consent, and then how to document a consent. So basically, let's go very fast in this case. Mrs. Cope, a 24 years old woman with insulin-dependent diabetes, is brought by her husband to the emergency department. She is tuberous with severe diabetic ketoacidosis and pneumonia. Physicians prescribe insulin and fluids for the ketoacidosis and antibiotics for the pneumonia. However, although Mrs. Cope was generally somnolent, she awake while the IV is being inserted, and she stated loudly, "Leave me alone, no needles and no hospital, I'm okay." Her husband urged the medical team to disregard the patient's statement saying she's not herself. So here we have a patient coming, and she's having uncontrolled diabetes, is clear. She refuses the treatment, but her husband tells us, go ahead, go for the treatment. Let's think about it, and we will discuss it by the end of the session. So, to begin with, what is an informed consent? An informed consent, basically, it's a process, not a document. It is a process by which a fully informed patient can participate in choices about his or her health care. So basically, again, it is a process through which or by which a patient can decide whether he will take this treatment or not. It's also a consent which is obtained freely, without threats or improper inducement, and we will talk about that in a minute to give some examples. After appropriate disclosure to the patient of adequate and understandable information in a form and language understood by the patient, and this is very important actually, to make sure that we talk to the patient in a language they can understand. It's not a matter of saying the medical information. It's about to say it in a way that's understandable by the patient. So, why to take a consent? If we're talking about the ethical basis, ethically, as we mentioned before, one of the most important, or one of the four principles that we agreed at the basis of healthcare, or the ethical basis for healthcare, is autonomy. Autonomy, again, it's you should respect the patient's ability to take their decision related to their own health. How can you reflect your respect to their right to autonomy? It's by giving them the right to consent. This is ethically. Legally, it expresses the right of the people to make informed decisions about health treatment. So it is provided by law that people should not be forced to receive a treatment, unless in a few exceptions, and we will talk about that later, by law. So by law, people are protected, and they have the right to accept or refuse treatment. If we're talking from a fiqhi point of view, Islamic point of view, basically every adult, male or female, has the competence or the dhimma to take a permissible or al-fi'l al-mubah, the permissible act or decisions related to their lives, unless there are genuine causes to assume the opposite. I mean the opposite, that this person do not have the capacity or the competence, and we will talk about that in a minute. So when do we need a consent? We need a consent that would include any procedure undertaken for the purpose of treatment, including diagnosis, for treatment, diagnosis, anesthesia, fluid infusion, blood transfusion, any kind of invasive operation, and any form of medical or surgical treatment. So basically, all of these require some sort of consent. So what is a treatment that needs consent? Does any kind of treatment needs consent? Basically, we're talking about therapeutic, preventive, palliative, diagnostic, cosmetic, or other health-related purposes by a health practitioner, okay, like a doctor, a nurse, physiotherapist, etc., and include a course of treatment or a plan of treatment. That is to say, it's not a single-time kind of thing. It's a plan. For instance, you're giving a drug, you're making an operation, that there will be consequences related to this decision. So basically, the patient has the right that any of these interventions which will affect his or her health, they have the right to have their consents. Okay. For a consent to be valid, actually there are three main conditions. First is the capacity, the second is disclosure, and the third is voluntariness. And we will talk briefly about this, these conditions. First, regarding the capacity, when should or could I say that this patient had the capacity to decide? If they fulfill basically four main criteria. First, they should be able to understand what we are saying to them. Second is to appreciate the risks included with the treatment, and we will explain that in a minute. Then to remember what they have been told, and then to communicate. They are able to communicate their decision whether they take it or leave it. I'll give an example. The question is, do you think that there are some patients who can understand what you're saying to them but cannot appreciate the risks? What do you think? Okay, yes, there are. For instance, I'll give an example. If, children can understand what you are telling them. Okay, you are here in the hospital, I will give you a pill, like one in the morning, one in the afternoon, or we are going to the operation room and make this operation for you, etc. So children can understand that they are in the hospital, they can understand that they are going to the operation room, somehow they can understand that, but can they appreciate the risk involved with this operation? Most probably no, because the children do not have enough experience to appreciate, but the adults, because either you have been exposed yourself to a previous experience for a surgical operation, for instance, or hospital admission, or at least you have seen a relative or a friend who has gone through a surgical operation. So children is one example. Another example is about patients with, for instance, uncontrolled depression. In the severely depressed, uncontrolled depression patients, actually, they can understand very well what the risks involved. They can understand what we are telling them. But the point is about the appreciation of risk. Sometimes, if you come to an uncontrolled depressed patient and they have suicidal tendencies, and you tell them that this operation had this risk and that risk and that risk and that risk, they would welcome it because they want more risk, because simply they want to die at this point of time. So basically, we have to be very careful when we are assessing our patients whether they have the capacity or the competence to take a decision or not. The third item or criterion is to remember, because some patients, especially who have transient loss of memory, or the elderly patients, you can just, at this point of time, you tell them, and then if you come 2 days after and you ask them, and they said, I can't remember anything. What did they tell me anyway? But this is one thing. And again, they should be able to communicate that, and especially if, for instance, if they cannot speak or they are unconscious. So we need to make sure that they have the capacity. The second is the most important, and we will come into more details in the coming 2 slides, about the disclosure. Disclosure means that you, the doctor, the treating doctor, should tell the patient the information needed by this patient to take a decision about his condition. This information should be in an understandable way. About the voluntariness, and this is quite important actually because we don't give much attention to it. The voluntariness means that your patient is free from undue influence. For example, if there is a woman, okay, and you ask her if she wants, for instance, cesarean section. Perhaps that, okay, she wanted to save the baby, or she does not, she's afraid of the operation, she does not want the surgery. But because her husband is nearby, and she's quite a tough guy, and she is afraid that if she said no, that something bad could happen to the baby, and then she might get divorced, for instance. And then this is kind of what we call the undue influence. This is somehow the community pressure on the patient. This is one way. Other examples of undue influence, if you are offering your patients kind of a payment or extra service in the hospital, if you tell them, okay, if you, for example, take this operation, do this operation, the consultants will come to see you more, and we will take care of you more, etc., etc. This is kind of undue influence that could affect the patient's ability to take a decision. So basically, in brief, disclosure refers to the provision of relevant information. Capacity refers to the patient's ability to understand and appreciate the consequences of his decision. Voluntariness is to make sure that the decision is taken freely without any force, coercion, or manipulation. So if we're talking about the capacity, any adult is assumed to have the capacity, okay? However, there are what we call the reasonable grounds to make us doubt that this person is not, does not have the capacity to do it. Can you give me an example of an adult patient coming to you and you start to doubt that this person may not be, in a position to take a decision about his health or her health? Okay. Yes, this is one example. Like, for instance, if he's coming to you drunk, okay, you have a drunk patient coming just like that and telling you, doctor, you don't do this to me. Okay, this time you start doubting that this person is not in his full capacity. As we mentioned, because the patient should understand the condition for which the treatment is proposed and the nature of the proposed treatment, the alternative of the treatment presented by the health practitioner, to appreciate the reasonably foreseeable risks. That is to say, you tell them, okay, we can go for this operation, but there's a risk related to infection, there's a risk related to anesthesia, there's a risk related to, for instance, an injury of an artery, etc., etc., and you tell them that there are these risks, and it's okay. Is it okay with you? You still want to go to the operation? They said, okay. Or sometimes they just change their minds. Let's come back to the case. Okay. Regarding the capacity, if we come back to the case of Mrs. Cobb, she's 42, she's an adult, okay? But what is the point here? She came, she has insulin-dependent diabetes, she came stuporous. She's not fully conscious. And she was like kind of drowsy when they found people, injecting her or putting the fluids. She said, no, I'm fine, I don't want a hospital, it's okay, no needs, etc. However, her husband said, forget it. So basically, there is the reasonable grounds to consider that Mrs. Cobb at this particular point of time is not capable, although she might have been able to take a decision like before going into the diabetic coma, and she is perhaps tomorrow or after tomorrow, after recovery from the coma, she is able to take her own decision. But at this point of time, her capacity to take the decision is not considered. Therefore, the team should not listen to what she mentions and go for what's in her best interest. Okay, if we're talking about the disclosure, this is, I would say, the hardest part, if you like, related to the consent, because you need to tell your patient information. The problem is about the amount of information and about the language of information, because we have a problem. Most of our medical education, most of our teaching is in English. And I would assume that at least in Saudi Arabia, most of our patients are Arabic speaking. So basically, we might find it difficult to translate or to interpret the terminology, the medical terminology related to treatment. However, we have to try our best. what we need to tell our patients before they decide. First, the nature of the process and the process of the intervention. The nature of the treatment. Is it a medical treatment? Is it a surgical treatment? Diagnosis and prognosis. Okay, this is your diagnosis. You have pneumonia, you need this antibiotic. You have appendicitis, you need appendicectomy. You have a tumor in the ovaries, you need to remove the ovaries, etc. Expected benefits of the treatment, you tell them that, okay, if you take this antibiotic, you will most probably be healed within this particular time. Or even if it's, say, cancer patients, you tell them that, chemotherapy, this is one alternative. If you go for chemotherapy, then these are the results. This is the expected outcome. And if you go for radiotherapy, this will be the outcome. Material risks of the treatment. Okay, chemotherapy is good about this and that, but it has this and that problem. Material and possible undesirable effects. Sometimes it's not serious effect, but undesirable, like just nausea, vomiting, diarrhea, whatever the side effects for the drugs. Alternative course of action. Don't tell your patient that I will do this for you. Just give them alternative. This antibiotic is available, and this antibiotic is available, and this, for instance, surgical operation is available. And let them choose what's good or better for them. Possibilities, benefits, and risk of alternative interventions. Tell them, if you go for surgery, this is the benefit, this is the risk. If you go for medication, this is the benefit, and this is the risk. Okay? Likely consequences of not having the treatment. Tips for disclosure. If you want to disclose or you tell your patients these information, what you should consider or have in mind. First, avoid technical terminology. And I know it is difficult for us as doctors to start speaking about health problem without using terminology like ascites, like jaundice, like anemia, or this terminology that common people usually do not understand. Attempt to translate statistical data into everyday probabilities. I'll give an example. One of my surgery teachers used to explain to the minor effect or the minor possible risk of a surgical operation to one of his patients, saying that the patient asked him, is there a potential risk that I develop severe complications or even death? He said, yes, but it's very little. I said, how little? He said, like, okay, if you go out of your, he said to the patient, okay, tell me, if you go outside your house in the morning, is there a possibility that a car hits you and make irreversible damage or break your bones or even kill you? He said, yes. He said that, would that stop you from getting out of the house? He said, no. Then he said, okay, why don't you do the operation? It's almost the same probability, the same potential to have that risk. So basically, you try to translate or interpret these statistical probabilities into everyday events. Inquire whether patients understand the information. You should invite your patient to. It's not a matter you tell them, okay, this is the first option, this is the alternative, this is the risk, No, you should give a chance. Look at your patient, invite them to ask questions.